Hi, Joanne Oliver. Hi, I'm
Hi,
Nikisha Washington.
Nikki.
Hi, how are you? I just wanted to take time out to say thank you for taking time out of your busy schedule to talk to me about the healthcare, the non-payment of Medicare's reimbursement for total hips and total knee replacements.
I appreciate that, Nikki.
Thank you.
Yeah, I'm going to try to keep this as short as I can, so
Okay.
stop me if I get too winded.
Yes, ma'am.
Some of the background on this was really established quite some time ago, and it had to do with the Deficit Reduction Act.
Yes, ma'am.
The most important part of that is that our cost of health care right now for things that can be avoided is over $250,000 per incident. That's a lot of money.
Yes, ma'am.
So what is more important here is that we try somehow to reduce the cost of health care. And we have control over this type of thing to be able to reduce.
Okay.
So when they started, they just had a few conditions.
Mhm.
Now they have more and more. And I anticipate they'll be adding more every year. What the Joint Commission says is that you have to have evidence that the bulk of the adverse effects were something that can be prevented by widespread adoption of achievable practices. We can do that.
Okay.
That the events must be able to be measured accurately, and thirdly, that it's possible to differentiate between the events that began in the hospital and those that were present on admission.
Exactly.
And that's important.
Exactly. That was a question that I wanted to bring up. Do you think that the bill is a final solution, and is it really fair to penalize the hospitals for infections that may have been pre-existing?
The bill is not a final solution.
Okay.
Just as being able to prevent infections, you're never going to be able to prevent them all.
Yes.
But what you're really looking at is what we can do. The cost of healthcare is skyrocketing, and medical errors can be reduced. You can do them through education, through training, through actually just paying attention to what you're doing. You have to have administrative support. You have to have the doctors and the nurses being able to talk together. And you need to be able to use tools like timeout and
Yes.
many other innovative things.
And
that
the
you
skip
can do.
initiatives also.
Absolutely.
Exactly.
So
Okay.
remember, money is what's forcing us to talk.
Yes.
And this is only the beginning. Right now, the states are not required to do this.
Okay.
But they're strongly encouraged to look between linking payment and actual performance.
Okay.
So that's the way this is going.
Okay.
Now, as far as what we think about this problem of infection control, can we do it or not? Well, what we've got to do is remember to go back to the basics.
Yes, ma'am.
The strict hand washing things, the policies, the
Yes.
procedures, the guidelines, the recommended practices we work so hard to put together. We have to
get back
follow
to the
those.
basics.
And
Exactly.
we have to be able to do that working as a team, not just between you and I or you and the doc, but the whole healthcare community.
Exactly.
And we need to be able to work with the legislators to help them understand. They don't know. They really don't know. We have to educate them as well. And if we can save money, my gosh, everybody will be better off.
Yes,
You don't
we
want to
will.
have that kind of death rate. Is what it amounts to.
How do you think it's going to affect the future of nursing?
I think it'll be a vast effect. Number one,
Okay.
we're so used to doing the same thing. We have to be creative and do more things. We need to be able to be more cognizant of the cost of care as well
Okay.
as the quality of
Okay.
care. And as the shortages come on, that's going to be harder and harder to do. Administration is going to cut wherever they can cut. But some hospitals and clinics, I predict, will close because they're not going to be able to be reimbursed enough because they're not taking the good quality of care they need. I can see nursing taking a much more supervisory role and being able to help non-nurses and non-doctors and so forth be able to work more appropriately.
Okay.
I can see standardization becoming more prevalent. It's prevalent now, but it will become more so. And I can see technology, it will continue to increase and increase and increase to where we're required to do these. But then we've got the data to be able to see where we're making mistakes and how we can correct these.
Okay.
The statistical analysis will become extremely important. There's two things I want you to remember in this.
Okay.
One is that innovation and cooperation will become paramount.
Okay.
And two is the I care motto will be something that we have to live by.
That's right. I care. I care for the patient. I care for the family because we are the advocates.
Absolutely.
We are the future of their health care and we are their voice.
And we need to expand that knowledge,
Yes,
and we
ma'am.
need to contribute back and forth. So thank you so much
And I thank you.
for
thank you.
allowing me to have this time.
And
with
thank you for taking out the time.
You bet.